The Li-Fraumeni syndrome is a predisposition to cancer. It's one of the major cancer predisposition because you have a large spectrum of tumor. You have breast cancer of the young woman, bone or soft sarcoma, eventually in the children. You have leukemia, you have some brain tumor, and you have adrenocortical carcinoma. That means a tumor in the adrenal gland, which is near the kidney. So this is the core spectrum of the tumor in Li-Fraumeni. But in fact, we discovered more recently that the spectrum could be very larger. In fact, it's all the tumor which can be related to the TP53 gene. And it's a gene which encodes a protein which is very critical for the DNA reparation. And if you have an alteration of the gene and the protein is not produced, you have a major risk of DNA alteration accumulation, which led to the development of a cancer. We assume that the risk is near 100%. We can say 90%, but in fact, all these people will suffer at time of their life from a cancer. The question is, will they face to the cancer in the young age or at the end of their life? But we know, unfortunately, that this risk of cancer is very consistent in the Li-Fraumeni syndrome, and it depends of our lifestyle habits. If you are TP53 carrier and you smoke, of course, you increase your risk of lung cancer or other cancer. And yes, we discuss no smoking, no excess in alcohol consumption, to make physical activities, to limit the sedentarity and the obesity, which are some additional risk for cancer. So it's a part of the education of the patients. The other part is you have to follow some specific program of screening. To face to this increased risk of cancer and sometimes earlier risk, we have to adapt and to tailor a protocol, a screening protocol for these patients. And the protocol of Toronto was proposed and published. And in this program, children and adults will follow an essential exam, which is MRI. Why MRI? Because the TP53 mutation is at risk for X-ray imaging, because X-ray can break DNA, and because of the TP53 mutation, the cells have not the same capacity of reparation. So if you do a CT scan, of course, it's a very low X-ray exposition, but it can be sufficient, and we have to try to reduce this risk. So the MRI is not an exam which exposes cells to DNA damage, so it's a good exam. But you have to perform a whole body MRI because the risk can concern all organs. So from the brain to the feet, you have to check every year with a whole body MRI these patients. And for the woman, we have the risk of breast cancer, and you have to consider after 20 years old, an annually breast MRI associated with ultrasound exam and clinical examination. So for the woman, you have 2 MRI per year, and for the man, the child, you have 1 MRI. In some case, we had abdominal US exam in order to check for the adrenal glands and other things. Of course, the clinical examination is recommended minimum twice per year, and you have to make some blood tests for the leukemia risk and the sign of any neoplasia. We accept to not overtreat, but overfollow to make an excess in the way we follow these patients. Because everyone could understand that if you do a breast MRI and you find a millimeter tumor, you can remove it and you have a better prognosis. But if you find a small tumor in the brain, it's not the same. Maybe a glioblastoma, a very aggressive tumor. It could be placed at a location where the neurosurgeon cannot remove it. And you can have very aggressive tumor, such as adrenocortical carcinoma, which can grow fast and be at risk of metastasis or non-operable situation. So, of course, we are convinced that we have the possibility to capture the tumor at the beginning of the development, but with a 12 months interval and the risk of very aggressive disease. Unfortunately, we diagnose some advanced tumor in the Li-Fraumeni syndrome.